latest corona recommendations. I'm joined by John Campbell. He's a medical doctor who also works as an independent health analyst. Welcome to the program. What do you make of the US president's suggestion of injecting disinfectant to clean the body of coronavirus?
Well, disinfectants are certainly produced to disinfect surfaces and to disinfect objects. They're not to be used to disinfect the virus in the body. And the idea of drinking disinfectant or injecting disinfectant would both be highly poisonous things to do. If you drink it, it's going to go into the stomach, it's going to cause inflammation in the stomach, and it will be absorbed and can poison you. And if you inject it into the bloodstream, it could kill you straight away. And if you inject it into the muscle, it's going to damage the area of muscle and cause an injection abscess. So it's certainly not something we would want to do. These things are for cleaning surfaces, not for giving into the body in any way.
What I thought. But Mr. Trump also suggested treating patients with ultraviolet or UV light. Is there a science behind that, and could it possibly work?
There is. There's ultraviolet light as part of the sunlight natural spectrum, and that does have antiviral properties. So if a virus is on a surface, then the ultraviolet in the sun will start to kill that virus over a period of time. So natural sunlight's good for this virus, and the higher the temperature, the less time the virus will survive as well. But of course, the problem in COVID-19 infection is not a virus on the surface of the body. The virus is actually down in the lungs, infecting the respiratory epithelium lining the lungs. So there's no way that the light's going to go from the outside through into the lungs. And likewise, there's no devices we could put down into the lungs that would illuminate the lungs from the inside, because the virus is in a billion different little bronchial passages. I'm afraid it's not practicable.
Okay, so most experts estimate that a vaccine is at least a year out. You know, isn't there a case of desperate times call for desperate measures? Can we completely toss out ideas, even wild ideas at this stage?
It's a very good question. There is something called compassionate prescribing, where doctors can prescribe drugs to patients that aren't actually proved to work yet. But there's always a balance in healthcare, that anything that's got the potential to do good has got the potential to do harm. And certainly those particular ideas that the president was sort of thinking out loud really would do harm. So we don't want to do those. Now, individual doctors may make decisions on individual basis about treating particular patients with drugs that are unproved. And that's their decision if they decide to do that. But we certainly don't want to do any harm. We've got to be very careful about doing harm. And this is one of the things with testing the vaccine. Vaccines can do harm as well as doing good. So we have to make sure that the vaccines are safe and that it's efficacious, that it's going to work.
OK, Dr. John Campbell, thank you very much for your insights.
Thank you, Christine.